This conference will now be recorded.
Good morning, everyone. Myself, Dr. Sowjanya. I'm from Radio Diagnosis Department, and today I'm going to teach you about MRI basics. What is an MRI? MRI is magnetic resonance imaging. Um, though many people have contributed and obtained Nobel Prize in MRI, Paul Lauterbur obtained a Nobel Prize, but father of MRI is considered as Raymond Demedian. What are the uses of MRI? Most ailments of the brain like infarct, hemorrhage, tumors can be easily obtained. The sports injuries and musculoskeletal abnormalities can be easily obtained like ACL injuries of the knee, other abnormalities of all musculoskeletal system can be recognized, and spinal cord injuries like traction, any fracture and neural compressions, etc. can be easily recognized using MRI. And vascular abnormalities like stenosis, any thrombosis can be easily recognized, and any prostate cancers, gynecological cancers like endometrial carcinomas can be recognized. MRI is mainly used for the soft tissue pathology because compared to the CT, MRI has a better tissue contrast. Though those are the people who can't have MRI are the people with the cardiac pacemakers and aneurysmal clips in the brain and cochlear implants or bony implants or metallic foreign bodies in the eye during the trauma. Those people can't have MRI because MRI consists of the magnet. So the implants can be dangerous for the patient. What are the advantages of MRI? MRI consists of non-ionizing radiation compared to the CT, which is lethal for the patient, which can cause stochastic and deterministic effects on the human body. And compared to the other modalities, MRI gives a better contrast resolution, and the details of the tissue can be obtained without the use of any IV contrast. What are the disadvantages of MRI? MRI is an expensive machine, and handling is should be very careful, and expert handling is needed during the handling of radio frequency coils and etc. Claustrophobic patients like who are afraid of the closed spaces, and closed spaces, it is difficult to obtain in those patients, and the patient needs to stay still for about 15 minutes to obtain sections of the desired part. So any kind of movement blur can cause artifacts in the images. It is very dangerous for patients with metallic devices. What are the 4 steps to get MR imaging? To get a good quality MR image, place the patient in the magnet, and there will be a radio frequency coil through which we will send the radio frequency pulse, and we will receive the signals from the patient by the same radio frequency coil, and these received signals are transformed into the computers, and they are converted into an image by the complex processing in the computers. So this is an MRI machine, which can this is a magnet, and here the patient is placed, and this is a radio frequency coil. This is a head coil. Similarly, there are different kinds of body coils, knee coils. Here we can see the patient is placed in a head coil to obtain the image of the brain. So how an MR image is obtained? MR imaging is based on proton imaging. Proton is a positively charged particle in the nucleus of every atom which is present in our body. Since hydrogen has only one particle, it is equivalent to the proton. Most of the signal on MR images comes from the water molecules that are mostly composed of hydrogen. Why we'll choose hydrogen as a proton in MRI? Because there are different kinds of protons, calcium, phosphate, etc. are present in our body. Why we choose hydrogen? Because hydrogen nucleus has an unpaired electron which is positively charged. Every hydrogen nucleus is a tiny magnet which produces small but noticeable magnetic field. Hydrogen atom is the major component in the body that is MR sensitive. It is abundant in the body in the form of water and fat. Because most of the 70% of the body is composed of water, hydrogen is the preferable to obtain MR imaging. So protons are positively charged and they have a rotatory movement called spin. Any moving charge generates current, and every current has a small magnetic field around it. So every spinning proton has a small magnetic field around it called as magnetic dipole moment. Normally protons in human body move randomly in any direction. When external magnetic field is applied, that is when the patient is placed in the magnet, these randomly moving protons align along the external magnetic field and they spin in the direction of the external magnetic field. So some of them align parallel and some of the protons align anti-parallel to the external magnetic field. When a proton aligns along the external magnetic field, not only it rotates around itself, which is called spin, just like the earth rotates around itself, it also has an axis of rotation, moves forming a cone. This kind of formation is called precession. So what is the difference between spin and precession? Spin is the rotation of proton around its own axis. Just imagine the earth which rotates around itself, and precession is the spinning proton under the influence of external magnetic field. It forms a cone from deviated from the center of the axis. It forms a cone with the influence of external magnetic field. So this is the difference between a spin and precession. The number of precessions of proton per second is called precession frequency, which is measured in hertz. Precession frequency is directly proportional to the strength of the external magnetic field. Stronger the external magnetic field, the higher is the precession frequency. So the relationship between this external magnetic field is expressed in the expressed by Larmore's equation, which is equal to gamma and B naught, where B naught is the external magnetic field and gamma is the gyromagnetic property. So the precession frequency of hydrogen proton at 1 Tesla is 42 and 1.5 Tesla is roughly 64 and 3 Tesla is 128 megahertz respectively. Because the 3 Tesla MRI has the highest precision frequency, it will give us a better contrast resolution and it will be useful in obtaining a clear and better contrast images. So there are two types of magnetization. One is longitudinal magnetization and the other is transverse magnetization, through which we will obtain the MRI images. Imagine two kind of axes. One is z-axis, which is a longitudinal magnetization, and the other is xy axis, which is transverse magnetization. Longitudinal magnetization is it is a component of net magnetization vector parallel to the magnetic field, that is along the z-axis. This is due to difference in the number of spins in parallel, the parallel and anti-parallel state. The spins which are in parallel state are of low energy, hence they appear parallel to the external magnetic field, and the high energy protons are anti-parallel to the external magnetic field. This longitudinal magnetization present before a radio frequency pulse is switched on. Here can see where the z-axis and xy axis, the black arrow is the longitudinal magnetization. After switching on a 90-degree radio frequency pulse, the longitudinal magnetization will slowly turn into a transverse magnetization in the XY plane. Usually, when a patient is placed in the MRI machine, the Z axis will be along the patient in the machine. When the RF pulse is switched on, this longitudinal magnetization will turn into a transverse magnetization. And immediately after switch off of the radio frequency pulse, slowly it will convert again into longitudinal magnetization. During this process, the radio frequency coils will obtain signals from the kind of tissue, different kind of, the patients, the different kind of tissues having a long T1 and long T2, and we can see explain later. Here we see the transverse magnetization as I explained before. It is a component of neck magnetization which is perpendicular to the magnetic field, that is along the XY plane. This is due to the spins of individual protons getting more or less into the phase after radio frequency pulse. When radio frequency pulse is switched off, longitudinal magnetization starts increasing along the z-axis and transverse magnetization starts reducing in the transverse plane. The process of recovery of longitudinal magnetization is called longitudinal relaxation, while the reduction in magnitude of transverse magnetization is called transverse relaxation. So how can an MR signal is obtained? The precision frequency of transverse magnetization rotates at Larmor frequency and it induces electric current. The receiver radio frequency coil receives this current as MR signal, and these MR signals are transformed into a complex process in the computers by Fourier transformation. So how can these kind of signals will localize? To localize from where in the body signals are coming, three magnetic fields are superimposed on the main magnetic field of XYZ planes. X and XY and Z axis are the main magnetic field, and extra three magnetic fields are superimposed on these magnetic fields, which are also called as gradients. So along the Z axis, slice selection gradient is superimposed. It will be superimposed just after radio frequency pulse is switched on. And x-axis phase encoding gradient is superimposed just few minutes after switching on the radio frequency pulse, and along the y-axis the frequency encoding gradient is switched on just after switching off of the radio frequency pulse. So by this we can localize the signal from where it is in the body coming from. So what are the types of sequences we obtain in an MR image? There are different kinds of image which are still under development, though many of the MR images kind of sequences can be obtained. In that, most important is T1 weighted and T2 weighted image. In this T1 weighted image, we can obtain anatomy. We can see the anatomy clearly in a T1 weighted image, whereas in T2 weighted image, we can see the pathology very clearly. Coming to the FLAIR image, it is an inversion sequence of the T2, which is called as fluid attenuation inversion recovery. And diffusion weighted and ADC sequences are the complete opposite of one another, where by this we can easily detect the infarct, epidermoid cysts, abscess. We can easily differentiate these kind of things by using diffusion weighted and ADC. These are quite opposite to one another. And coming to the proton density weighted imaging, this will be very useful in the brain. It uses the density of the protons in the brain or any bony substances. So STIR is short-term inversion recovery, in which the fat is suppressed and the surrounding pathology can be easily recognized using the sequence. Because the fat gives a bright signal, it can suppress the pathology. So by suppressing the fat, we can obtain a good image using the stir sequence. Similarly, FATSAT, which is just similar to stir sequence, can also be used. And post gadolinium images. Gadolinium is the contrast used in MRI. These post gadolinium images are obtained after giving a contrast, which is not very necessary unless to differentiate between the tissues and pathology, we will give contrast in MRI. Coming to the MRA and MRV, which will be useful for vessels, MR angiography and MR venography, to know the pathology like thrombosis uh, and stenosis in the vessels. And coming to the perfusion weighted images, in perfusion weighted images, we can know whether the tissue is supplied with the enough blood or not. So by that we can know whether the tissue is infected or not. And similarly, functional MRI and bold MRI. Bold MRI uses the blood oxygen level dependent, etc. kind of sequences are available. So what is the main sequences? T1 and T2 weighted imaging. T1 and T2 are physical properties of the tissue. The tissue is exposed to a series of radio frequency pulses at predetermined intervals to elicit properties. It depends on the response of the hydrogen nuclei. So, how to know the difference between T1 and T2 weighted images? Here in this flare, it is just just similar to T2 weighted imaging, except the fluid is suppressed. Hence, the CSF appears dark in T2 weighted imaging. Rest all the same as T2 weighted imaging. Here, the difference between the T1 and T2 weighted images are CSF is dark in T1 weighted images, whereas T2 is bright. Water is white on T2. Just remember that. And white matter will appear light, and T2 weighted images has a dark gray white matter. White matter, because white matter consists of fat, the fat will usually appear white on T1. Hence, the white matter also has will appear light and bright. The cortex appears gray, and T2 in T2 weighted imaging it appears light gray. As I said before, fat appears bright, and T2 weighted imaging fat appears light. In T1 weighted imaging, the inflammation like infection or any demyelination appears dark, whereas in T2 weighted imaging, it appears bright. Hence, we can differentiate with the T2 weighted images. The infarct can be easily recognized on T2 weighted images to confirm that whether it is any fluid intensity or it is of infarct. We will use the flare sequence to confirm whether it is infarct or not. So here we can see the T1 weighted images, T2 weighted images, and flare images. Here the cortex appears kind of white matter appears white, and here the white matter appears dark, whereas the CSF signal appears bright. Here we can see the CSF fluid intensity in the arachnoid space and the ventricles appear dark. Here we can see the anatomy very clearly. This is the thalamus and this is the putamen, the dark one. And here we can see the caudate nucleus. And here the white one is the internal capsule. So any doubts? Thank you.